According to the National Cancer Institute, over 200,000 women will be diagnosed with breast cancer this year, and their options for treatment are greater than ever before.
The future of any kind of medicine is personalized, and even more so when we're talking about cancers.
Medicine is moving towards more precise and conservative treatments for breast cancer, including hormone-blocking drugs and drugs that attack specific abnormalities within cancer cells. But recent events in the news have some women considering much more radical options.
In the case of Angelina Jolie, for instance, she has BRCA1, and according to her calculations, her lifetime risk of having breast cancer was 87%, and lifetime risk of having ovarian cancer, 50%.
The BRCA1 and BRCA2 genes work in the body to keep DNA stable and to make sure cells don't grow out of control. But certain mutations of these genes can dramatically increase cancer risk.
A normal non-mutation carrier woman in a lifetime has 8 in 100 chance of having a breast cancer, whereas a woman with BRCA1 or 2 will be as high from 40 to 70-something%. Similarly, a normal woman will have ovarian cancer 1.5% over a lifetime, whereas these women can have very high risk, up to 50%.
Along with carrying the gene mutation, Angelina Jolie lost several family members to breast cancer. According to Dr. Maney, the celebrity's decision to undergo prophylactic mastectomy was medically sound. But Jolie's unique medical history has many women now considering this radical medical procedure as an option for treating the disease.
This is an area where there's a clear discordance between scientific evidence and personal choice, because clearly on a scientific level, we are trying to conserve as many breasts as possible. However, I think women are they're asking for more and more mastectomies. It is just a fear reaction for the most part, and I think even in cases where it is probably not medically indicated, this is the only way sometimes that they can feel secure and lose the fear of having the cancer come back. And the perfect example of that would be Juliana Rancic. She had a lumpectomy, and after the lumpectomy, they still found, I think there was remaining cancer cells in the margins, which required that she would have to undergo another surgery, followed by radiation, followed by possible chemotherapy, followed by possible anti-estrogen therapy. So everything. So she made the decision that she would much rather have a double mastectomy and not have to go through any of those things at all. On a personal level, women need to be comfortable with their decision making because they need to feel secure and disease-free several years down the line, rather than doing everything now, which is a lot of stuff. It's surgery, it's radiation, chemotherapy, anti-estrogen. So it is a lot to go through. But scientific evidence is moving towards breast-conserving surgery. So there's a clear-cut dichotomy here.
Despite what decision a woman makes concerning her treatment, early detection is key to beating breast cancer.
I think the most important thing is that the preventive mammograms should be done by everyone, because the earlier it's caught, the better it is. And all of this thing that we talk about, the personalized medicine and breast conservation and this and that, is completely based upon earlier detection. Unfortunately, even in this day and age, we see so many women presenting for the first time with very advanced stage disease. And then you cannot have all those finer touches which we have strived so hard to create.
Dr. Maney expects this trend in more personalized treatment and care to continue. For Comcast Newsmakers, I'm Candace Kelly.